Hello? Hi. You're waking up. Great. How are you feeling? Okay. Okay, do you know where you are? Good. Very good. Do you remember how you got here? Yes, okay. So you were in an accident. Okay. Everyone's fine. Everyone's being looked after. But you did get a little banged up. Are you in any pain at the moment? Okay. Your forehead? Just there? Yeah, okay. Anywhere else? Your collarbone? Yeah, okay. Okay, well, my name is Dr. Gray, and I will be looking after you today. I'm here with my assistant as well. She's just going to take some notes, and hopefully we can get you out of here pretty soon. I think you're probably going to be able to go home today, okay? Alright, so the first thing that we're going to do is get some information from you. Just need to get some vitals. I'll just do your blood pressure first, okay? So if you could just put out an arm for me, please, whichever one. Do you mind rolling up the sleeve? Thank you. Okay, perfect. Here we go. Put your arm out for me. Okay. Okay, here we go. Right here. Okay. Alright, so I got 170 over 75. Alright, and do you know if you normally have low blood pressure? Oh, okay, well, that answers that question anyway. I want to just check your blood oxygen level as well. This is going to measure the oxygen content in your blood as well as your heart rate. So you could just stick out your pointer finger for me there. We can just clip this on like this. Okay. Just give this a second to see what it says. Okay, yeah, great, great. It's really good levels. Okay, great. So you're doing great. All right, now the thing that I want to do today, most importantly, is get some of these cuts bandaged up. All right, so I'm gonna get some cleaning done first. Just gonna get antiseptic cleanser on here. Shouldn't sting or anything. Alright. Just a little bit on here. Now, this one on your forehead is the first one I'm going to treat there, okay? So, okay. Is it hurting? No? Okay, good. Good. Thankfully, it's not deep. Most of these cuts just seem to be surface, mostly from, I'm guessing, road burn rather than glass or something, you know, just something we often see in car accidents. Okay. Great, okay, that's clean. Put a bandage on it. Let's just get this on there. Yeah, did you say that there was somewhere else that was hurting too besides just the forehead? On the back of your head? Okay, do you mind if I take a quick look at that? Alright, let me just see that really quick here. Hold on, I'll come around. Alright, so just back here you're saying, huh? Yeah, okay. So you're not actually bleeding there. It just seems like you've had a bonk on the head. Pretty common stuff to expect when you're in a car accident. It's from your head hitting the back of the seat. I don't think we're gonna have to do much about that, but I do want to keep an eye on that. Did you Did you want a concussion check already?
Yeah, pass.
Yeah, I mean, I assume from the...
Yeah.
Okay. Well, look, we're gonna do just a quick, before I put a bandage on it, I'm just gonna do a quick check to make sure you didn't get a concussion, okay? All right, give me 1 second. Let me grab my... Hold on, just 1 second. Okay, so I'm gonna play follow the pen, all right? So here's what I want you to do. I just want you to focus, okay? Focus on the tip of the pen. And I'm just gonna move around. I want you to follow it with your eyes, okay? Here we go. So we're gonna start here, and up here, okay, and down here. Great. Over here. Perfect. And up here. About here. Okay. Again. Again. Good. Okay. Okay, good. I want you to just cover one eye now. Yeah, don't mind, whichever one. Perfect. Okay, here we go. Again. All right. Okay. Okay, switch eyes. Okay. Yep. All right. You're doing great. Doing really good. Okay. Good. Okay, that's fine. I'm gonna check one more thing here. So I just kind of focus on the center of the pen. Okay, one more time. Here you go. Okay. Well, your eye response is perfect. So are you feeling nauseated or no? You feel just the pain? Okay. Okay, well in that case, I'm not too worried about a concussion, but I will have my assistant send you home with some aftercare instructions, things to look out for concussions, okay? Okay, great. So, let's see here. Put this bandage on here. So we're gonna just... Here we go. So I'm just gonna place this right there. Okay. Yep, just like that. Could you just hold that in place for me, please? Thank you. Get some tape on there. So we're gonna want to get this changed. The aftercare instructions, this needs to be changed twice daily. Okay, twice. Okay. Yep. Yeah. Go. Why can't I get this tape?
It's new.
Oh, I forgot they did that. We restocked the supplier we don't normally use, and the products are just, well, they're better quality, but they're harder to use. Okay, so we're gonna pop this tape on your forehead there. Okay, perfect. All right. Now, this one on your arm is looking a little bit more intense. All right, so with that one, I think I will have to do a bit more of a thorough examination, unfortunately. Apologies if it causes any discomfort. I will try and be as quick as I can. Just like glove on here. I think it's just road burn from when you were ejected from the car. But road burn can be quite nasty if it's not treated properly. So, alright, so here's what I'm gonna do. I just want you to hold out your arm like this, alright? And I'm very lightly going to just touch around it, and I want you to tell me, your pain level. Okay, and again, I'm really sorry I have to do this. So let your arm, please. Okay, just gonna press here. Okay, how about here? All right, this side. Okay, up here. All right, okay. I'm just gonna feel the other side of your arm as well. Hold on. Okay, okay. That's not too bad. It's not nearly as deep as it could have been. I am going to just, again, cleanse it. So I've got some cleanser here. Just gonna dab this on lightly, alright? Shouldn't sting. Okay. Alright. So this and the bandage is gonna have to be replaced 3 times a day, okay? 3 times, okay? So, alright. Here we go. So it's nice and clean now. I'm going to just see here. Just gonna apply this on. We'll just tape it down, okay? Again, just a gauze pad. I'll send you home with a million of these. And let's get some tape. So I'll place this. I'll actually unfold this. Here we go. This tape that I'm using is very easy to remove, so you're not going to have any issues with that. Alright, so I'm just going to place this there. If you could hold that down for me, please. Thank you. Tape here. I swear, it's going to take a while to use this. Okay, here we go. Place that on. Just like that. Perfect. Okay. And the other place you said you were hurting was your collarbone, was it? Okay, so I am gonna have to apply some pressure there. I do want you to let me know. Again, pain level 1 to 10, kind of what we're feeling, alright? So I'm just gonna press. Okay, so that's quite sore. Alright. Yeah, I think you definitely have a fractured collarbone, which is very painful, but thankfully is very straightforward when it comes to healing. We're just gonna have to immobilize it there for you. Okay. Yeah, I can feel a fracture right there. Okay, so fracture collarbone, got it, fortunately. So I'm going to use this bandage to immobilize your arm. All right, not your arm, but yeah. And I want you to come back if you aren't noticing a marked improvement in your pain levels or your mobility in 1 week, okay? All right, so here I'm just gonna wrap this around. Okay, I'm gonna pull it tight. Okay, there you go. All right, so that's that all done. Want to just, where? Okay, yeah, show me your finger. Yeah, okay. Ooh, yeah, okay. Let's immobilize that. So thankfully, I do have a finger splint here, so this is just gonna basically go onto your finger like this. Alright, I'm gonna squish it down, and then we're going to apply this to it, and this will immobilize it, okay? And then after about a week, we should be able to just tape one finger to the other finger, called the buddy system, and that'll help strengthen it, but give you a bit of range of motion back, okay? So, finger please. Yeah, you really did get beat up, you poor thing. Okay, there's your finger. Alright, so I'm gonna pop that on. And just apply this to help it stay immobile. Okay. Yep, looking good. Alright, anything else that's bothering you? Oh, okay. Oh, on the top of your head. Just there. Okay, let me just, I'm gonna clip your hair back so I can see, okay? So. So, yeah, okay, obviously a bandage is not going to work there, so I'm going to use some of this. This is a liquid adhesive bandage. It'll last for a couple of days, last long enough, but I would avoid shampooing your hair over the next few days, okay? So hope it wasn't wash day tomorrow. Alright, so let's just check this out. And this has antiseptic in it, so we won't need it to cleanse the area or anything. Okay, just a little bit. Alright, here we go. So just on the top of your head there. Okay, looking good. Alright, so let that dry down. Okay, so you're looking good. I will just leave my assistant here to go over aftercare instructions with you. What would you say your overall pain is out of 10 at the moment? 7, okay. So, not great. Let's just see if we have any. We usually have. Okay, perfect. So I have some ibuprofen here. You can take these every 6 hours, and if your pain levels, in fact, you know what? Yeah, let's do 1,000 milligrams of Acetaminophen. Oh, okay, yeah, fine, cool. So you can take these every 6 hours, and then every 4 hours you can take, I'm going to prescribe you a 1,000 milligram Acetaminophen tablet, and you can take that every 4 hours. So it's good to stagger them. So maybe, let's say at 1 o'clock you take ibuprofen, and then 2 hours later you can take Acetaminophen, and then at 7 o'clock you can take your, you can take them both, okay? So there's 2 in here, so we can open these up. All right. Okay, here you go. Okay, so this empty, so let's throw that away. Throw it away. And the last thing I want to discuss with you, so with road burn, the product that I prefer to use over the counter is this ointment here. This is a sterile honey ointment, and honey works great as an antibiotic, and it also works really good at helping new tissue grow. So you can apply this every time you do a bandage change, all right? And you can get this at any drugstore. So this one, could you add that to the list as well?
Yeah, that's fine.
For the pharmacist.
Sure.
Yeah, thank you. Okay, so this is a really good one. Do you have any questions for me? Okay. Yeah. I mean, I'll include all of that about what time to change. I know you've had a busy day, so I'm not going to expect you to remember everything I said today. That'll all be in the aftercare instructions, all right? Okay, well, thank you so much for being patient with me today. I'm so sorry about your accident. It's not nice, but you're very lucky, and you're going to be on the mend very soon. Okay? All right. Nice to meet you. Bye. Hi. Bye, love. Okay, so pretty straightforward. I just want to check a couple of things with you. I want to know what your date of birth is, please, and your full name. Okay. Yeah. Okay. With an E? With an E. Okay, perfect. And I just need to know what your pharmacy of preference is. Do you know the zip code? Okay, yeah. So that's the one on South Jefferson? Okay, perfect. I'm gonna have that sent there, and then so I'm prescribing you, well, she's prescribing you amoxicillin, which is an antibiotic, which is going to help fight off any infections you might get on the arm and the head. And then as well, we're going to prescribe, like she said, the 1,000 milligram tablet of Acetaminophen, It's basically just like Tylenol, except for instead of taking 2 tablets, you just need to take 1 tablet because it's like twice as strong. So I have all of the dosage instructions here, and the pharmacist will go over all this with you when you pick up your prescription as well. Okay? Do you have any other questions? Okay. Yeah. Well, you can check all that out at the front desk on your way out. All right? And she'll have that printed out for you at the front desk as well. Okay? Well, perfect. Okay. Well, I hope you feel better soon. All right? Okay. And give us a call if there's any problems. Okay? Okay. Bye.